So PAD, otherwise known as peripheral artery disease, sometimes also called PVD, peripheral vascular disease, is where the arteries of the body, typically with the arms and the legs, become narrowed, sometimes occluded. Narrowing blood flow to the arms, mainly really the legs, sometimes the carotid arteries in the neck. So typically, if a person has peripheral artery disease and it's advanced, when they exert themselves, when they walk, when they ambulate, then we get a symptom called claudication. And then they come to me and say, hey doc, you know what, I'm fine at rest, but I start walking and now my legs really hurt. And when I rest, I feel much better. That is a huge potential sign symptom of PAD. So PAD is typically caused, as we mentioned, narrowing of the arteries, legs, carotid arteries, sometimes the arms. The risk factors for that, big ones. Diabetes, especially uncontrolled. Smoking is just a horrible risk factor for PAD, and limb ischemia and strokes. Of course, there's also cholesterol, uncontrolled blood pressure, lifestyle, smoking. So controlling, once again, kind of like any other major medical condition, diabetes, heart disease, strokes, controlling those modifiable health issues really can help prevent a poor outcome. PAD is typically initially diagnosed or suspected when a person has symptoms consistent with claudication or maybe visual disturbances or symptoms of ischemia, poor blood flow to the legs mainly. Sometimes it's not obvious, maybe not having symptoms, but if you look at a person's leg and they don't really have much hair growth or their extremities and toes look dusky, cool, and maybe pale, very strong suspicion for poor blood flow. It is further diagnosed by initially perhaps doing an ABI, ankle brachial index, which is a blood pressure reading between the arms and the legs looking for a difference. It's imaged by arterial ultrasound looking for blood flow and velocities as well as compressibility of the arteries. And it can be confirmed through imaging, vascular studies that use IV contrast. So there are degrees of PAD, and if we detect it, maybe we find non-occlusive PAD, like the carotid arteries, we do a sonogram and there's less than 50% or even 70%, or the legs we detect it. And if it's not affecting anything too significantly, we want to modify those risk factors. It's really important, Senator Man, that you stop smoking. It's really important that we get your A1C under control. Now, if we have occlusive disease that is causing problems, like my leg hurts, I've got an unhealing ulcer, or I feel like I've gone blind in an eye, that means that the blood flow, there's a problem with the blood flow secondary to PAD. And so sometimes patients need revascularization, stents, opening of the arteries to restore blood flow. It isn't successful in everybody, but depending on the patient and the degree, it can be highly successful. Of course, what we're trying to avoid, amputation, premature death.